I'm heard from 7 to 7:30 each Saturday, right here on WSBR 740 AM, is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning, Dr. Mencia. We're so happy always to talk together.
And we have predicted that 2015 is going to be a great year, and so far so good. Everything is really looking great.
Well, you look great. You know, that starts it off.
You do.
Dr. Mencia walks in here with his beautiful shirt and tie. And for those of you who need a Saturday appointment, I have used that Saturday appointment so many times now lately.
It's so popular, and it is so popular. I'm so happy we have done it. And one of the patients say, "Are you ever going to do Sunday?"
No, we need a little time.
I say, "Not myself, but I probably will put somebody there." Because I go there on Sunday and I do administrative work and do a lot of meditation on the business, the structure of the business, what else we can do better. And one of the things that I love to do on Sundays is when I have difficult cases, I sit down by myself and I open the computer and I put the paper in front of me like a puzzle. I say, let me see how I can put this thing together. And you'll be amazed how many things on Sunday I'm able to solve. So when the next day comes, Monday, I'm ready to roll.
That's wonderful of you, Dr. Mencia, to do that. And I can understand that because you have such a busy office that everybody needs you for this and that. And there are certain kinds of patients and situations where you do need personal time to really get the great benefit. But I wanted to talk a little bit about, and we can't do it too personally, but you do have a personal situation where you're, I don't know, we can even talk with you, your mother-in-law.
Yeah.
She's very fortunate to have you as a son-in-law because...
And as a doctor.
That's what I'm saying. That's what I'm saying. It's a private patient, and she has a private physician. And that's what got me started thinking about this. How many people would love to have, they can't have their son-in-law do it, but they could have a private physician who really watches over them when they're in trouble. And they're in trouble, many of them at home.
Well, you look at her situation, and, in your field as a gerontologist, you have the geriatric care managers, and they are not necessarily gerontologists like you. They are basically people out there that take a short course, and they present to people that need a personal care manager for their health and sometimes for their personal finances. And this person will come in. And I try to work with them because we need someone there to help with this patient. But over the past 20 years, I have seen the huge difference when you have, let's say, a gerontologist, when you have a person that has just taken a course to become a geriatric care manager, and when you have a geriatrician becoming a personal care manager. So, for people that can afford, I have worked in the past with very well-off individuals that need a personal care manager. And the company that have called me, which is one of the largest privately owned companies in the world, this was probably some 12 years ago. The company that called me and they said, money is not an issue for us. So people can go from all extreme, where they are well off, but, it's not that money is not an issue. Money is an issue for them. And cases like this one, that money was not an issue. And they say, we want the best of the best for our father. We can afford whatever it costs. And we want you to go there and do an assessment for us. And the patient live here in Broward County, where we are here in Boca. The patient live in Broward County. And I went to his house. It was by the beach, beautiful place. And I noticed he needed a lot of stuff. His condition with congestive heart failure. He was a diabetic. He has what we call alcohol-induced dementia. So very interesting, very challenging case. And so I called the chief operating officer of this privately owned company, and I explained to them all the things that I thought they would need. And I didn't even include myself. And they said, well, we don't see you on the list. I said, well, I didn't know if you just want me to make an assessment. I said, no, we want you to take over the case. Whatever you need there, put it there. Whatever doesn't belong there, take it out of there. You have full power. So what I did, I started interviewing chef because money was not an issue here. So I interviewed chef to make sure the chef will come in and they will cook exactly the type of food this person will need so that I can improve his quality of life. I interview no companion, but nurses, registered nurses. And I put nurses around the clock because I didn't want him to go into congestive heart failure. I didn't have, and the rest of the year that he did live, he never went back to a hospital. Was never admitted back to a hospital. Not only that, when they have the corporate meeting, where the kids will come in and the family and all the chief financial officer and the chief operating officer, all the people from the company will come in internationally, they will, the kid will request that the father will be sitting there at the meeting, even though he was, somewhat demented, what have you, but they wanted his presence there. And I will rent a Learjet. I will have an ambulance, a private ambulance in Michigan waiting for me. And I will take time off to fly over with him, go to the meeting, go back to the Learjet, fly back. So, and they have my phone number. Not only I did that and put all the nurses and all the staff, I have private physical therapy to work with him because I already have the nurses. Last week we spent time talking about home health. This was all privately acquired, nothing through the insurance, which he had, of course, Medicare and excellent insurance. He could afford anything he wanted. But they wanted to go beyond that. They wanted to make sure that Daddy was very well taken care of. So not only we did that, but I put camera. That now they are so popular, those small camera. But 12 years ago, if you recall, they were not that popular. They were hard to get. There were very few companies in the world that could give you those cameras that you could view through the internet. Now you can see it on daycare for kids and adults and in school, all over. But at that time, were not that popular. It wasn't that easy to get. But I have my staff basically working for me to make sure that I fulfill the needs of this company and this patient. And I put camera throughout the entire house. So all the kids, they have a login name and a password, and they will log in anytime they wanted to, including myself, and make sure that Daddy was out of bed by this time and that he was by the pool. And I put a hydraulic lift so that I can help him go into the pool anytime he wanted to.
Amazing.
And it was amazing, all the things that I was able to do for this individual. And then after he passed away, I said, well, I don't think I want to keep promoting this thing. But now I see my mother-in-law going through what she's going through. She bragged about me. She said, because my son-in-law is a geriatrician, and he had kept me this well so far, and he had done so much for me. And, that personal care can be done. You hear about some private groups out there that will charge you $5,000 a year to go for you to have access to them, and they have made it like a business. And whatever I do in life, I do not want to stop practicing medicine. I remember one patient, he passed away. I never took the case. Wanted to hire me as a geriatrician, and he would pay me basically whatever I was producing in my company. a yearly salary for that, but I will be just his private physician for him and his immediate family.
Very nice.
Yeah, but I thought, I
Yeah,
cannot stop
that's not-
practicing
no,
medicine. No. I say, if I can do anything like what I did with that other
Right.
patient, I say I'm available for you.
Right. Find people that'll do, and you oversee it.
Exactly. And I will have put all the staff, I will put everything that need to be there. So that's how the idea of this company is sort of coming to reality.
I absolutely, in over a period of 25 years, have seen a lot of things, as you said, and, in a different capacity than a doctor, but I've been living this with so many people. And I think that is the one fallacy of one aging, that they're at the mercy of their environment, unfortunately. And even if they have family members, the family members have their own life, and that's when you start getting elder abuse. I don't mean physical, but mental. It's very difficult.
Financially.
Yeah, so if you could figure out how you can start another part of your company, a branch of your company called Personal Medical Management, where someone who, and it doesn't mean that they have to have the great wealth that you've just spoken about.
Exactly right.
But just even thinking back what you did for Bill. Now, of course, I was there to watch over everything. And when you had a nurse come in, even if it was a half an hour, and just to assure him that he was okay. But if I were not there for Bill now, he would need somebody. He would need someone to say, your hearing aids aren't working, Bill. You have to do something about it. Or, you went to a podiatrist and your foot doesn't look very good. Because if he has macular degeneration in one eye, he doesn't see things so clearly.
Right.
So this is just a microscopic of what is out there, Dr. Mencia,
And
in so many homes.
The thing is, like, you look at a case like that where you have macular degeneration, the hearing becomes so important, and also for the podiatrist, the feet become important, because if you need insert in your feet, if you need anything to help you walk better, that gives you a better balance, and then you can compensate for the macular degeneration. But when you have all the senses being affected, and then you neglect this, take it for granted, and you take a person like Bill, because I've been involved. One of the things I have done is been an expert witness in geriatric cases of elderly abuse and neglect. And Anita, over the years, I have seen cases of people well off that had been used and abused. I remember one case of a patient that had invested in real estate, and he made a lot of money. He was very well off. And he would come to the office just as a regular patient. And I never asked about people's finances, so I didn't know. And he never dressed to what he was making and all of that. But then the case became a legal case, and I said, wow, this person in court, what's going on? And it wasn't him. It was one of the sons that live out of state that was coming here to court, and they asked me to be an expert witness. Not only he's my patient, but I was an expert witness as a geriatrician. And he had a nurse that they hire on their own. So the nurse will come in, and they will put an ad, and they will call the son over the phone. And the son, if they like what they hear over the phone, they will call Daddy and say, somebody's going to come by the house. Let me know if you like her. So they did hire somebody in that form of interview. And the lady became very close to the patient. And she said, oh, my daughter is now going to college.
Can you help?
Can you help me? I need to get an apartment for her. So he bought an apartment. Then he had the lady gave her asked him for a coin collection.
Right.
And now she was controlling him so good because he totally depended on her.
Of course.
He couldn't get away of anything. So then the case went to court, and guess what happened? The lady, as the case went to court, and there was all proof there, in the house, because she would not leave the house, in the house, she had a heart attack and died.
No.
Then the kids of the caregiver sued the family.
Oh, I can't believe that.
They went to sue the family because their mother now died in these people's house, and they knew these people, were very well. And I was all involved in the case because I happened to be an expert witness. So the case was shut down and said, okay, they said, the lawyer spoke, and they said, okay, we're going to stop here. So as an expert witness, I have seen a lot of abuse. So sometimes, people that can afford to say, let me have a geriatrician come in, let me have this company, what we're going to call it, personal medical management.
Yeah, I think personal.
Or geriatric personal medical management.
Well, something, yeah, maybe. Because
I don't like geriatric because you get a lot of younger people. I have a younger person that is a good friend of mine. I see him, and he's bilateral amputee. And he lives in the same building that I live. And he's very well off. The guy is probably in his late 40s.
And he's a double amputee.
Double amputee. And he was telling me how he looked for help, how he go and I said, I don't think that is a good idea. And I didn't want to offer my service because I said, this have to be well structured for me to say, listen, go to my company, we might be able to help.
Yes.
Versus,
very much. I am very excited about this, Dr. Mencia. I just have to jump in here because I think that almost every home where there's an elder person, they could almost use this. Now, the problem will be how much money it costs. So it can be on a sliding scale. It could be based on what people can afford.
What can afford and what they actually need.
Right. Because I was thinking about what you were saying there. Let's go back to that nurse. Let's say they had come to your company and they put you in charge. You would have made sure that the nurse, first of all, she knew. Check. Yeah, but even that she would be intimidated by knowing there was a geriatric physician there and watching over everything you're doing. But let's just talk about the benefit.
But something?
Yeah.
When what people don't understand, because we do home visit, and it's a very touchy situation. What people don't understand is when you are in the hand of an abuser, if you read in psychology regarding abuser, what do they do to the victim? They isolate the victim. They completely isolate the victim. So the moment the home health care company come in and they start asking too many questions, or if a visiting physician come in and they start questioning, they fire you. They say, no, we have another doctor now. They isolate. So they control. They have to keep total control. So it's it's very tricky for people out there that they know they need help, but they know they need a doctor. They know they need a visiting doctor. To start doing it on their own, because, for example, the case from Michigan, all the nurses, I told you I have registered nurses, not only companion. I did have some companion, but registered nurses coming in. You will be amazed how some of the RN I interviewed that I really like a lot. When I did the full background check, there were some hanky-panky stuff in the past that I said, I don't think I want that. This is my father.
Amazing. See, I'm so excited about this. I want to get through just telling people how they can get you, and then I want to go back to this because I am so sure, just as when we started Boomer Times, I knew the right kind of thing that needed. I think this is needed so well. I see this as the taking your company and all the things that you've worked so hard to build and making it now into another company, and you can actually almost take this national because in every home. Anyway, let me tell everybody how they can get you. I'm very excited about this.
Thank you.
AGI Medical and Dental Centers. That's short for Adult Geriatric Institute, but it's really nice. AGI Medical and Dental Centers. And they started in Fort Lauderdale many years ago. Dr. Mencia has been there. He's, as we say, paid his dues. He's had such wonderful, wonderful compliments and satisfaction, and it's so successful that he saw that the population in Palm Beach County really wanted him also. So they opened up another center out there off on Hagen Ranch Road between Boynton Beach Boulevard and kind of like Woolbright, over there on Hagen Ranch Road. And it's a gorgeous facility. And, of course, Dr. Rosemary is there all the time with her dental center. They just have so much. And what they have really is what you're hearing on the radio show. Love, kindness, intelligence. It's a unique organization. And the phone number, let's give you the one to call in Fort Lauderdale, because they will answer the phone. If you need to make an appointment in Boynton, they'll get you there, because I know there are too many phone numbers. It's 954-489-1345. 954-489-1345. Go to their website, which is agifl.com. And they're open Saturdays. There's some wonderful things that Dr. Mencia does. That's why we're talking about all this. So this is the story, Dr. Mencia. As one ages, as you know, so now they're in their 70s, and like I am. And now you're in your 80s, and then you're in your 90s like Bill is. I was thinking about this the other day. Something happened to me. It's more than having his daughter come in. It's more than that. They need to have you and your company say, okay, this is what Bill needs. This is where he has to go. We have to have a constant watching of him, because he is so precious to me and to the family. But unless you have really cognizant, if you really have professional knowledge in the medical world, that person is not going to make it. They're just not going to.
That is so true.
And you hold the keys to this, Dr. Mencia, because you understand more than anyone I've ever met before what an older person needs, and you include love and friendship and kindness. See, it isn't just...
And respect.
Yeah, yeah. And you will make sure that the people who come have the same background and feelings. So it's the champion, the leader that has to pull something like that down. And so we have to now develop something. And I hope that our listeners can help us too. What is it that you need? That you need in your home as you can't get in your car and go and do things you need? What do you need that will make you feel happy and comfortable? Who's going to make those appointments for you? You forget your doctor's appointments. You can't drive anymore. You'll ask anybody to drive you somewhere. It's very serious out there.
It's very serious, and there are many patients that unfortunately not only they get neglected because they depend on somebody else to take them to a doctor, because they don't want to have a stranger coming to the house, so they get a friend or acquaintance to drive them or pay somebody to drive them to a doctor. But then once you are at that doctor, basically, if you need some kind of minor or major surgery, you are at the mercy of who is going to see me. Now, in the background, you can have enough money that you can say, let me have this geriatrician do the research for me. It's simple. Let me give you an example. My mother-in-law, she fractured her elbow. And hip surgery, knee surgery, any orthopedic doctor will tell you those are easy to do because they do so many of them. And even shoulder surgery. You get doctors that you ask them, they do a lot of shoulder surgery a week. But elbow surgery, that's such a rarity that you have to really do your research. So in the case of Agabni, when she fractured her elbow, guess where I sent her? To
New
York City.
And it was successful, wasn't it?
Yes. And a hospital of special surgery, because there are people there that do this surgery every day. Because that's what people that only specializes on elbow surgery. So the research is so valuable to have somebody to be able to do this for you. And one of my patients, her husband used to have a printing company. So he left her estate, and in the printing company, she called me in and she said, do you think you can help me? And I said, well, you still have a great prognosis in front of you. You have many years in front of you. You do not need a registered nurse or anything like that. But yes, I can interview. And I did. Basically, she was one of those private patients. But her worth was not huge, but was enough for her to be comfortable. And I did hire, I did a background check, and I put a companion that lived with her for 7 years. And she was very happy. And basically, I was able to then step out of the case, and just as needed, they would call me in.
Well, as usual, we get into all these heavy subjects, and I'm very excited about this, and we've run out of time, Dr. Mencia, but we definitely need to talk about this. This is, I think, a big issue. We need to bring Rosemary in, and we need to bring in people who understand it, and let's develop another piece of what you do, because it's where the future is, and I know that. I really see it.
Absolutely.
So thank you so much always for being here.
Anita.
Saturdays is open. If you have any of these problems or questions, call him, and he'll sit with you, and maybe he can help you figure this all out. So thank you very much for being with us.
Thank you, Anita.
And we will see you again during the week, and just stay with us. We're going to go to our next guest. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.